Medical Watch is sponsored by UChicago Medicine. Sickness is relentless. So are we. Visit uChicagoMedicine.org.
On the Medical Watch, where do military medics learn to treat combat injuries? For some, right here in Chicago.
There is quite a bit of similarities between gun violence that we see in the city of Chicago and wounds that we see in war.
My name is Amy Grand. I'm a lieutenant commander and I am a trauma surgery PA.
Lieutenant Commander Adrian Corduba, emergency medicine physician.
They've come to Chicago to learn.
I'm Jeff Henderson, lieutenant, nurse anesthetist on the team.
My name is HM2 William Wall, and I'm the respiratory therapist on the team.
At one of the busiest trauma centers in the country.
I'm HM2 Kyle Imparato. I am the surgical tech on the team.
What kind of separates us apart from the rest of the country is our high volume of penetrating trauma.
Gunshot and stab wounds account for 25 to 30% of the cases at Cook County Health's Stroger Hospital.
The amount of traumas, penetrating traumas, and blunt traumas, we can extrapolate that into what we will see on the battlefield. Absolutely.
There's a lot of pressure. A lot of times it's life or death situations and you have to make split-second decisions.
Trauma surgeon John Ruggiero, a Navy commander himself, helps lead the group as they navigate what are considered combat-like scenarios nowhere near an actual battlefield.
I haven't had the opportunity to train in this level for this amount of time.
The 7 naval medical providers have been embedded at Stroger since October 2022. They'll deploy as a unit later this year.
We're just going to examine your arm. Is that okay?
It's not a war wound, but the patient's deep cut, the result of a construction accident, offered a valuable lesson in penetrating trauma.
You have a big joint in there with all those little bones, so we've got to make sure that this cut didn't lacerate into the joint. That would make this a little bit more of a complicated repair.
A lot of the team members are coming from different backgrounds in the military where they haven't necessarily been taking care of traumatically injured patients on a daily basis.
We figured this was a great opportunity to use kind of for the best purposes possible, the environment that we're in here, and be able to do this great training for the Navy and have that sustainment of skills for the Navy.
I'm Brigham Douglas. I'm a commander in the Navy, and I am the surgeon.
The drills often extend to the operating room, where the team helped a gunshot victim who required a procedure on his intestines.
At Cook County, I'm getting a lot of background information from experienced trauma surgeons, and then more importantly, I'm getting more hands-on experience with operative trauma cases.
We're going to almost finish each other's sentences. That's where we need to be, and we are basically there, and it's a wonderful opportunity to be here to be able to actually do that.
So the goal is to get them as ready as possible to deploy so that, heaven forbid they see a casualty of a service member, they're able to save a life.
It's a great collaboration. The partnership, called ERSS, or Expeditionary Resuscitative Surgical System, dates back 10 years with the Naval Station Great Lakes and Lovell Federal Health Center in North Chicago.
Wow, what specialized training they're getting.
Right?
Thanks for
Makes
sharing
sense.
that.